and welcome to Health Matters on Channels Television. Thanks for spending this time with us. I am Mary Alale Yusuf. The global toll of confirmed COVID-19 cases is now above 1 million. Total deaths are close to 59,000 as at April the 4th, and recoveries have gone past 220,000 people. These figures are according to Johns Hopkins. The United States of America has the highest number of confirmed cases with well over 270,000 confirmed cases. Italy comes in a distant second, but has the most deaths at over 14,000. In Nigeria, as at April 4th, 210 cases were confirmed in total. 25 had recovered and 4 had died. Lagos, Ogun, and the FCT are locked down. So also are some states that have not recorded any cases. On April 4th, the disease was recorded in 13 states and the FCT, Ondo being the newest addition. My guest is a consultant public health physician and a senior lecturer at the Lagos State University College of Medicine, LASUCOM. That's Dr. Modupe Akinyinka. You're welcome to the show.
Thank you very much.
So we're about a week into our lockdown in Lagos. What can you say has been the benefit of the lockdown?
Well, I believe the lockdown is helping to try and flatten the curve. That is, we're not having as many cases as we would have gotten if there was no lockdown. Okay. If people were going up and down and about with their businesses as usual, we would have had many more cases by now. But with the lockdown, at least we have managed to reduce the number of cases, but we're not out of it yet. People still need to stay home and keep away, keep social distancing, keep washing their hands, and taking all the precautions so that we can reduce the transmission, so that even if we do get cases, they are not going to overwhelm us.
Now, what do the authorities do during a lockdown?
Well, during a lockdown, the authorities are meant to monitor the lockdown and ensure that people actually stay in their homes. They are not gathering, because sometimes when there's like this current lockdown now, some people just think, oh, it's a holiday. Yeah. Let's
play football.
Yes. Let's stay home and then go outside and play football, and then they are congregating again, which is counterproductive, because if one person that has it just goes there with them, then they all get it. They go to their homes, they spread again. So it becomes even worse than what we had anticipated. So people need to know that this is their own contribution. Now, our health workers are doing a great deal. They are the frontliners. The health workers working with those COVID-19 cases are the frontliners. But we, each individual person, needs to play a part. And our part is to obey those instructions and stay home. Just stay home, practice social distancing, keep away. You can contact people on the phone, you can use the internet and speak, FaceTime. Yes, and FaceTime, Skype,
Distance
WhatsApp.
Socialization.
Yes.
Anyway,
and socialize
now that there's a lockdown,
online,
the authorities don't have to go around like headless chickens, picking up contacts everywhere. So there's more time to take care of patients and probably more time to do other things. I know that there are some contacts who probably haven't been checked. Is that correct?
I'm not sure there are those that haven't been checked, but with the discovery of fresh cases, there will be more contacts to trace.
Okay, so how do we get fresh cases when people are on lockdown?
Well, the news has been put out that if people have symptoms or they have a history of contact with people, because the initial cases we had, or the cases we have had, have been imported cases. So if they have had contact with somebody that has traveled with somebody with recent travel to those countries that are hotspots.
Yes.
Spain, Italy, China, the US, the United Kingdom as well. Mm-hmm. And so if they've had contact, or they're having symptoms, they're having fever, they're having a cough, or they're having difficulty with breathing, then they're supposed to call those numbers, and then the authorities are meant to go to them and go and meet them, get them tested,
and then pick them up if they need to be picked up.
If they need to be picked up. Now, if they have not even been able to get through, or they are not able to do that, then if they need, or it's a dire emergency, and the person, it's a life or death issue, then the person, once the person is brought to a health facility, which would be one of the designated health facilities, preferably maybe the isolation center, then they need to have taken precautions like wearing a mask, so that they are not going to start infecting people. And then they give a truthful history and say what has been happening. What has the person been exposed to? What are you thinking about? But the best is to stay home and call so that they can come and be tested.
Okay, so people who are locked down obviously don't have as much freedom as they used to have. They can't run around and do stuff. What are the measures put in place, to help the lockdown be a success?
Well,
and how do these measures work?
Well, from what Lagos State is trying to do, they're trying to make sure that people get help, which is help as per food.
Okay.
So, and then they're taking these packages to the homes of these people. So that's the most vulnerable people, because most people who can afford it have tried to stock up before the lockdown.
Yes.
But we know that sometimes things may run out. But the most vulnerable, who may not have been able to do that kind of stocking up, now Lagos State is making sure that they are distributing those packages to them. And then this is something that each individual can also do in their own environment. If you know that there are people that may, be hungry or starving at this point in time, and they need that intervention, while maintaining the social distancing and everything, then we can also be of help to them and make available, if we have more than enough, and give to other people as well, because that will help.
While maintaining social distancing.
While maintaining
social distancing. So you go drop it at the door, knock, and move away. Oh, yes. This is so like the Spanish flu. It's scary. Anyway, so we have some downsides, of course, of the lockdown, which is some people who are vulnerable might just not be reached. Isn't that right? Or is there some sort of database that Lagos is using to get to everybody who might need this emergency food?
I believe they have a database. I think that was mentioned by, the commissioner or the governor, that they have a database of the most vulnerable people. But peradventure, some people have been left out. Then these people, once they do start to get hungry, would probably come out. And hopefully when they come out, they will get help from either the authorities or people around them that can then give them something, at least to help them through that period of the lockdown. Because as much as the lockdown is so important, we don't at the same time want people to now die of hunger because they're at home
or
and
resort to theft. That's another concern.
Which is another dimension of it. So as much as that is what we want people to stay home. We don't want them to start stealing. We don't want them
then we have the open markets.
Be hungry.
Which I think that was a wonderful idea. They look appropriately spaced if you're seeing it now. How many of those markets do we have now?
I'm not sure of the numbers that we have now. But
I know that the initial number was 25. I think they've worked themselves up to 50. Well, Lagos, we probably need more than that. Oh, this is good. This is really spaced.
Now, the problem with those markets is that now people have to go out, or people are now encouraged to go out. It's fine. We need to go out to get the food, but a lot of people would have stocked up already, and so may not need to go out. But because the market is now open, now they're encouraged to go out. So even going to the market, people should know that you don't go to the market and then you're going there every day. That's highly unnecessary. So people should plan for when they have to go to the market, and it doesn't have to be you know, it could be like once a week or once in the whole duration of the period. And so a good plan is made. So you go there, you get all the things that you require quickly, and then you come back and then keep, while you're at it, you maintain the social distancing and all of the wash your hands and don't touch surfaces anyhow, don't touch your face while you are out. And then once you get back, then you put everything, wash your hands and all of that. And that way, hopefully, we will reduce the number that even visit those markets as well. Because the markets, fine, they are good because we need people to still stay well nourished. But at the same time, we must not forget that COVID-19 can spread very fast.
And that's the reason for all these measures.
Of this in the first place.
We've been told that we have not peaked. We haven't reached the peak of infections yet in this country. When will we know that we have peaked?
Well, we will know that we have peaked once we start to see a decline in the number of new infections that we're having. Because once we have reached the peak, then what happens is that it starts to come down on the epidemiological curve. So once we now start to see a decline, so less people are getting infected, then we know that we have peaked and we're
now coming down. And from there, it's going to be downward all the way until zero, right?
Well, from there, we pray that it will be downward, downward. But at that point, we must not relax, because if we relax at that point, then the curve can have another peak
presumably, when you start to come down, it means you have a handle on things, right? And you can actually control it to some extent.
To some extent, yes. Okay. To some extent. But that is if you maintain that control. So if we say, okay, we have peaked and we're coming down, and then everybody starts going out, people are not washing their hands, people are not social distancing, then
it goes up again.
It goes up again.
So we just have to be careful throughout this period.
Until we can
now they said this lockdown was for
2 weeks. 14 days initially. The
part I don't like is in the first instance, meaning it can be extended.
Yes, because it's a projection because of the incubation period of COVID-19. So if within 2 weeks we all stay apart, we don't have any new infections, then the likelihood of, getting rid of COVID-19 is much higher. And then we're able to make sure that our curve starts coming down. Okay,
talking about curves and peaks and all that, how does the lockdown affect the peak? How does it affect the highest,
that we can get to?
Yeah.
Okay. What the lockdown does is that it keeps us away from getting the infection. So it keeps you in your house, it keeps me in my house. And so the number of new cases that we get are reduced. Okay. So when you reduce that number of new cases, what it means is that when we do get those new cases, and some of them may develop complications from the symptoms that they have, when they get to access our healthcare services, we're able to deal with it. We have the isolation center, and then we have another one in Onikon, and all the other isolation centers that are being prepared. Yes. So these isolation centers, they need healthcare workers. People need to man them. So if we're able to stay at home and then we reduce the number of infections, then we're able to cope with the number of cases that we have on ground. And so we're able to give them good quality care. And so the chances of their survival is much higher. Now, if we don't do that, if we don't stay home, and then people keep going out anyhow, and we have
they will
so many.
Overwhelm the system.
They overwhelm the system. And then it becomes a situation whereby you can't even give the quality of care that we can afford to give anymore, because there are too many. There are just too many people, like what's happening in Italy, where they had to be deciding who goes on the ventilator.
Wow, that is terrible.
Who should be left behind.
Let's go on a quick break and come back after that. Please stay with us and meet us on the other side of the break. Welcome back. This is Health Matters, and of course, we're talking about COVID-19. To ask any questions, do call 0805-468-3514. That's 0805-468-3514. You can also tweet at CTV_Mary A for any of your questions. Now, the lockdown, as you said, it keeps people at home. So I'm trying to understand, when people are at home and contacts are being tested, let's just say there are 100 contacts of people in the isolation centers. So tests are going on, and maybe they get some positives out of those tests. Does that give birth to a whole new set of contacts, the way it was before the lockdown?
Yes, it does. Because the people that are now found to be positive, you now have to determine, okay, so who have they been in contact with within the past about 1 week, depending on when you suspect that they had the disease.
Let me just put you on pause and take this call. Hello? Hello, Patrick? I'm afraid Patrick isn't there. Well, continue.
Yes, so depending on when they contracted disease, so you now have to find out from the new patient who the contacts have been, who they have been in close touch with. So you now have a list again of people that you need to follow up.
I think Patrick is still on the line. We'll get back to that, I'm sorry. Hello, Patrick.
Hello, good afternoon.
Good afternoon. What's your question?
Yes, please. I want to ask the doctor. First and foremost, I want to thank God that the number of patients responding to treatment is increasing. We thank God. But my question is, these people that are being discharged after the treatment, is it possible that they acquire natural immunity against the COVID-19? Or the other way around? Would it be possible for them to recontact it? I mean, in their careless?
Thank you, Patrick. So we'll put that to you. How safe is it to interact with somebody who has recovered, and can he get it again?
Now, like the people that have been discharged now, with the people that had COVID-19 that have been discharged, before they were discharged, they had at least 2 consecutive negative results for the virus. So that's establishing that they now don't have the virus anymore. And then we expect that because they have gone through the infection, we don't know too much about COVID-19 yet.
But going by
other viruses, we know that because they have been exposed and they've had it, then they would have developed antibodies. So they should have antibodies and they should be able to fight it again. But that seemingly, because I've read somewhere that some people actually got reinfected with the virus again. So that may not protect them from reinfection, but it probably will alter the course of the disease, so if they happen to have it again.
Continue to maintain your social distancing, continue to wash your hands.
Continue to take all the precautions. But that person would have a better chance, from what we know as per our response to diseases, should have a better chance at fighting it if the person contacts it again. But the person will not now be able to give it to somebody else because the person no longer has the virus, unless he gets reinfected.
That is good to know for the sake of their families. Now, we were talking about the pool of contacts. So yes, people have come in contact with this person. He has been found to be positive, so they have to go out, find his contacts. But because of the lockdown, wouldn't that pool of contacts reduce?
Yes, we expect, if the person has been following the guidelines and has actually stayed home all of the time, then the pool of contacts should be minimal. And it's probably just the people in the household with the person, if the person has been maintaining that, has been adhering to that and staying at home. But if the person's been going out, then you have a larger number of people that you now have to trace.
Okay, I want to read a contribution to you, and then you tell me what you think about it. It says the lockdown prevents spread of COVID-19 from people to people by ensuring there is no contact. When there is no spread, there will be no new cases of infection. Where there are no new cases of infection, the peak of the curve declines. Does that sound sensible? Let's quickly take this call. What do you think about that? Hello, that is Fabi.
Hello?
What's your question?
Hello?
Hello, we can hear you. Go ahead.
Okay. My question is, you said during this period we should be washing our hands with running tap, with soap, and later with hand sanitizer, alcohol-based. But what is there? If you take a random sampling, I guess the government are not even helping situations. Like Water Corporation in Lagos State has not been working. And these people have been going to fetch water just to at least even take baths, to even cook and some other things. I don't think it's really reasonable in this period of time. And Lagos State Water Corporation, I don't know what government is doing about that. I believe those are part of the things they should look into. Let water be running and let other things be in place. Than all these sharing, they are just doing. The main thing, the basic social amenities, they are not putting it in place. Please, I don't know how you can be of help passing this across.
We'll tackle that. Is Lagos doing anything about water, actually? Because that was a valid point he made. I know that they have these buckets that, have taps. So they can wash their hands with soap under running water. But how about if they need to fetch the water?
Well, as Lagos is now, we know that some people will still need to fetch water, definitely. The water from Water Corporation doesn't get to all houses, doesn't get to my house. So if people have not made a way of getting their own water, then they probably will have to fetch water. But what they need to know in fetching the water is that they shouldn't cluster around the taps. There should be still the social distance.
So fetch water if you must.
Fetch water if you need to,
But
yes.
try and keep to the rules.
Yes, keep to the rules. And once you have the water, then use the water. If you have that kind of bucket, fine. Then you can use it with the tap on it. But if you don't, then you just get somebody else to pour the water for you, and you are not touching anything. You just have the soap, and then you wash your hands for at least 20 seconds minimum.
Or sing happy birthday 2 times. All right, there's somebody else, Annie Fowoshe, is asking, is there a model to determine when Nigeria will get to the peak of the curve? Before you take that question, let's quickly take another call. Hello.
Hi.
What's your question?
I was going to ask, this whole coronavirus thing and it's spreading is weird because they actually told us we are on lockdown and all, and then yet it is still spreading. So the question is, how is it spreading actually? And apart from that, they keep saying we shouldn't wear masks and all, and then we should protect ourselves if we are going outside. That is just the doctors and all that have to. But we have to wear those masks because Lagosians don't listen to the whole lockdown thing. They would literally come close to you. There's nothing like social distancing. So how do you want us to treat that?
Thank you so much. Thank you so much. That's just our experience. So what's your answer? Let's start with the mask.
Well, the masks, the recommendation that we still have with masks is that those masks, the medical grade masks particularly, are for the health.
We need to do this all in 1 minute.
Are for the health workers, because there are different types of those masks. Now, the surgical mask, which is the more common one, the green one, the one that's green and white, that you would see people wearing. Now, generally, according to the World Health Organization, there's a shortage of all of these medical supplies. So if every single person is using those masks, then the people that really need them critically, they won't get them.
But how about if they make their own masks with cloth?
Exactly. So if
they feel threatened, they can wear those masks.
Yes, they can wear those masks.
Thank you so much. That's all we can take for today. But you were wonderful. Thank you for coming.
Thank you very much.
And thank you for being with us back there at home. Have a wonderful day. I am Mary Alale Yusuf.